Don't recall
Okay.
that one.
Well, this is real simple and it's very nice. For instance, when I click into that, it's going to load up a template. Now, this is another one of those templates where it closed everything behind me, but it does keep my left nav
Navigate
open.
on.
Yeah. But this is nice, Leva, because if you, like, maybe this patient, after it was seen by the doctor, has to be referred out to somebody. So you can do a referral request letter, and basically what it's going to do is, when I generate it, all you have to do is click on it. It's going to pull from the visits, and it's going to put data in there so that if I was referring this patient out after I generate
Another
this letter,
specialty.
yeah, if you have a faxing solution in place, once this generates, you can just do file fax and fax it right over to the doctor that you're referring the patient to.
Okay.
Yeah, so it's really nice. So, it just says, dear colleagues, patient was seen, and here it gives, just a synopsis of everything and, allows you to, do the referral with all the information from the encounter on it.
Okay.
So it's really nice. So all different types of letters in there, as you can see when you go through them.
Normal
so
letters,
pretty much,
work letters.
yeah, it's really nice. Missed appointment. We actually have a template you can use called Missed Appointment that you can generate the letter from. So if your patient's, like when you're doing recalls and your patient maybe is, not being compliant, you can document it in an encounter, and then you can generate the letter and send the letter out to the patient, too.
Oh, okay.
Yeah, so it's really nice. So lots of good letters in here. So if you do a referral, you're going to refer the patient out. You could, order the referral from the custom plan template on the tab that said referral. Then you could actually come here and generate your referral letter and send it right over to the doctor you're referring to.
Okay.
So let's save some trees, right? All right, so I'm going to come back over to my left nav, and I'm going to come back to my assess and plan here. See what else we have on there for you. So again, just a couple of additional fields they put on this assess and plan template. Again, doctor can review the allergies here. He can also review the patient's medications here, and at the very bottom of this template indicates all the instructions and orders that were done for this visit. So you can see, like, I documented the suicidal, homicidal risk. There's my urinalysis. This is my pregnancy test, the shot, the spin prep. So everything's on there for this order.
Okay.
The other nice thing, too, is here, like if the doctor at this point is going to order a medication for the patient or maybe renew something, there's two ways to get to it. We can click on history and obtain it from the tic-tac-toe grid here. And this, of course, will give you full screen. It'll create a second tab up here, another NDI tab. Or you could double-click right here in the grid and get it as a pop-up. So it's whatever everyone's comfort level is.
Oh, okay.
All right, but so always just remember, pretty much double-click in any grid, to get to what you need. All right, so I'll push pin this. One thing I want to double-check. Yeah, okay. Did Leanne go over how you can customize your toolbar up here?
To customize which one?
The toolbar right up here?
Yes.
Okay, so I like, for myself, for the items that you're constantly grabbing from the history toolbar down the bottom here, templates is one, allergies is one, and medications. You can actually pull these three modules and put them up here on this added extra real estate, so you never have to keep clicking into history.
Oh, okay.
Yeah, so just if anyone wants to do that, let me make my history toolbar go away. Come on, hide away, go, go, go. All right. So if you just right-click anywhere up here on the toolbar, you can go to this Customize option, and that just opens up a window again where here are the items that you can pull up onto your toolbar. So if I wanted medications, I just highlight it, I add it. It does fire it in over here, but then I move it all the way because I'm so used to working at the toolbar the way it is. So I move everything after the last. So it's really nice. So I move it after my close button because I'm so used to things being
on
here and then pulling them here. So that's really nice. So and that's user
specific.
specific.
You can go to customize your toolbar.
Just give it a right click.
Okay. All right. Good.
Yeah.
Good. I see.
And you can even make your icons, if you want to make them larger. It's a little too big for me, but you'll see how it looks. There it goes.
Okay.
Yeah. It depends on, your real estate and how much you want to add up there. So I'll just make
All
it
right.
small again. Okay?
Okay.
All right, so that's your document library. Now, to this point, if the doctor had to do additional orders, okay, when you click this active text link here, it's going to present a pick list. And it's basically no different than if you were on the custom plan, because you can see it's diagnostics, labs, office services, and referrals. So if you're utilizing the custom plan over here where I'm circling till it's full grandeur, really wouldn't think too often that you would have to come in here unless you were going to order something for a future date. Okay, but like you'll see what happens if I go to, say referrals. All right, you're going to see the template that pops up for me. It takes me right back to where that, if I clicked on custom plan. So that's why you can see as you kind of move from tab to tab to tab, you can get everything done from the plan component, right here at this one-stop template as opposed to maybe clicking a couple extra times. So, but it's there if anyone, if you don't want to, come back over and click on custom plan, then go to referrals, you can actually just select it from the pick list. Okay? So medications, nothing changes there. Allergies, nothing changes there. Again, there's all our instructions.
Okay.
You do have these next and previous buttons. I've never gotten used to using these because I'm so used to using the tabs on the top.
Okay.
So, but with whatever everyone's most comfortable with. So now we get to go finalize this chart. So we've seen our patient, we've addressed everything, we've done our procedures, everything's good, patient's got new meds, they're walking out the door. So I'm going to come in to finalize it now. And that's going to open up the finalized OV template. Patient advice. If there's any components here, this will all concatenate into this field up here. So unfortunately, there is no quick save functionality on here that we could just fire into every patient. But, at Well Woman, instructed to do self-breast exams, discuss birth control, reduce caffeine intake, take prescribed medication as prescribed, wherever it is. And you can see those items are all concatenated here. Okay?
Okay.
So after we do that, okay, and again, at the bottom of this template, do you have a scenario for like fellows or residents there, or all your doctors, they do any precepting work or anything?
Not too sure.
Okay.
I know we do have what is it, the physician assistant?
Okay. Okay. Well,
yeah.
then, do they need to have the physician
signed off?
Their
Yeah.
care?
Yes, I think Leanne went over that. She showed us.
Perfect.
This, yes.
Okay, so just submit it. It tasks the doctor can review it, sign off on it, and we're good to go.
Yeah.
Now, before we get into the E&M coding template, again, just a quick note, what they did down here was they gave you kind of a short list of documents. Okay, so you can go in, generate referrals or consults or whatever you may need. But at this point, I like for my doctors, before they do their coding, but again, it's totally up to the user, I would prefer that they preview their office visit, just take a peek at it before they code it. Because once it's coded, and you would have to manually go in and manipulate it. So what we're creating right now is the final chart note, or the Gin Master, as it's called. So we'll let that go ahead and run. And unfortunately, there's nothing, that this document has to run. It's got to run every macro on it, because anything I charted, anything I put into a field, it's looking at those macros, and it's going to pull it onto the document for you. And there it is. So what she presented with, her annual visit, her cervix falling out, and amenorrhea, and I'm sure Leanne probably went through this, but I've got my nursing comments. I mean, everything is on here. So it's your final chart note.
So this is a complete list.
Yep.
And even the doctor's plan is at the bottom of it.
Yep, it's going to be after. Let's see where we're getting. There's my exam. There's my. Keep going. There's my that repair we did. This poor patient had everything. Yeah. Let's see. Labs before, so assessment plan. So there's everything there that we did. The advice we gave our patient. Okay. Their medications, added or continued this visit. Here's our test that we did. All the results. Office services signed off.
Okay.
So if they're comfortable with that, I'm just going to close it. And then we're going to go to E&M coding. And this works no different than anything else. They have to do a level of decision making. The
And
coding
calculate
is
the
going
code
yes, the code is going to drive by the
from the
visit
initial
and,
visit.
and new or established. So we'll just say this was of moderate complexity.
Okay, so you have to select the decision making, but it will pull the type of visit and the patient established information from the beginning of the note.
Absolutely.
Okay.
And if they're ever curious what how it's, if they're unsure, which most doctors aren't, we do have this risk table that just pops up a little information on the different types, so they want to
low risk, high risk, moderate risk. Okay.
Yeah, so that's kind of nice. So now let's go and calculate, and I would say we'd have to get at least a level 4. Well, actually, it won't be. It's going to be, it's 396.
And you go modify,
Now, again, if I don't know if this is applicable to GYN or not, because I'm not a billing guru by any means. But if the patient was coming in for their annual well women, but another problem was discovered, I'm pretty sure a doctor can charge an additional office visit code for that.
Yes.
So they could come into this additional E&M code where they would hand select.
Okay. What other code they want to use? Yeah,
exactly. And then the reason, what's going on, because it wouldn't be any of those. What if this one gives me? Oh, that's kind of interesting. And then you have if you did any face-to-face time. So once you select those, you go ahead and submit your code. And that's it. And you're done. Just like that. So this template will gray out because once the codes are submitted, they're submitted. So if any changes had to be made, then you would have to go into the actual procedures module and modify them there. So that's pretty much it for like a well woman visit. So if it wasn't a well woman visit, obviously we would be picking from the list and then charting accordingly.
Okay.
Okay, so do you have any questions on what we just went through there, Leva?
No.
You will later.
I will, definitely.
But we're getting together again in the morning, so if anything comes up, we can always talk about it tomorrow.
Okay.
All right. So, I'm sorry, did you have a question?
No, I wanted to open, to do a patient, try another test patient.
Oh, do you want to chart one yourself?
Yes.
Okay. So why don't we do this? Why don't we just close this? And you want to just use the same patient?
Yeah, Mary just.
Okay. Yeah, that'll work. So we'll go to history. I'll create a new encounter, and off you go, my dear.
Okay.
So I think you just have to double-click the mouse, and it'll give it back to you.
Okay. So I'm adding another encounter for this patient.
Are you charting? Because I'm not seeing anything.
It's asking me an encounter already exists. Do I want to?
Yeah, just say yes to that right there.
Yeah,
because I don't see the mouse moving at all.
Yeah, it's not doing anything for it. Okay.
Oh. All right, let me do this. Let me get this pop-up in here. All right. Now, see if you can double-click the mouse and get it back on the computer that the WebEx is signed into.
Okay. Oh, I think it's on Dr. Dorfman's desktop.
That's all right.
That's why he is in control.
Maybe I can. Oh shoot! I can't pass it to you.
Yeah.
Wait a minute. Let me go into my participants and let me. Oh yeah, it's because of him.
Yeah. He is the presenter.
He's the boss.
Yes.
All right.
It's on his. I think he's in the room with a client.
Okay.
In his
well,
office
let me go into another encounter because now I want to show you what I didn't show you before.
Okay, no problem.
Okay, so new encounter, preventative visit, and again, patient's coming in for her annual visit here. All right, so we just went through all the way down the left nav side for the nurses. This really isn't going to change for them, but for the doctor, instead of going through these items here, we have in here a quick visit. And when I click in there, it lets me grab Well Woman Preventative. So I think Dr. Dorfman sounds like he's pretty computer savvy.
Yeah.
So if he does quick visits, I select it from here, and you can see you've got vulvar vaginitis, UTI, pelvic pain, adult, really abnormal vaginal bleeding. Those are the ones he would be using.
Mhm.
So when I click OK, all right, it's going to open up a template that looks different, kind of busy, but when you really break this down, I mean, when you look at this template right here, we have a look at everything that's already in there. It's got, it's pulled over the birth control from the previous encounter I did.
Mhm.
It's got her Gravidon parity. It's got all of her histories in here. I can look at diagnostics or I can look at labs. Okay? But what this does is this allows the doctor to chart the entire visit from a SOAP perspective, staying pretty much on one template. So I don't have to go through all those tabs on the GYN office visit, because here I can go ahead. I mean, of course, last menses wouldn't pull in there, but I can do all that information. I can put in symptoms. I can do med-surg history, family history. Here's your social history. So after he charts all this, of course, is the subjective. Look what he also has.
The save.
He built his own quick save. And I think, excuse me, yeah, Nexion doesn't come with any here. But he
All right, so
I
I have a question, a quick question. Say, for instance, two patients come in today. She ran out of her orthotricycline low, and all she needs is a prescription to get a quick one until her next visit. She was here like a month ago. She has a follow-up annual visit in 2 months.
Okay.
So that's all she's coming for. As the nurses, from the nurses' perspective, we go into the same Well Woman quick visit and subjective?
No, actually, the easier way to do that would be, she wouldn't be seeing the doctor, right?
No, she would not. She would just, the doctor will just be charting that he's giving her one order and keep her follow-up appointment in a month for annual visit or whatever the case may be.
What I would do instead, because you wouldn't charge for that, would you?
Yes. No, sorry.
Okay.
No.
So what I would do for a visit type, okay, I would you can do two things here. You can just make this a chart update, okay, for GYN. Then we could put a nurse comment on it, said patient presented for refill of birth control pills, and then go right over to the medication module and do it.
No, okay.
Yeah, I would just do it. You would create an encounter because you're not billing for the visit, and she's just in going, oh, geez, I need a refill. So it would be more or less a nurse visit, and then you just go ahead and chart what she was in for, what you did, and then go to the med module and order it.
Okay.
That's how I would do it. It would be too much. It's too much work. Again, we'll just do it. So it's a chart update. Okay. She could even just put in reason for visit. Let's see if we got
refill.
Yeah, let's see what we got in here. It is pouring here again. Let's see if there's anything for prescription. Don't see anything, but you can always grab the free text line at the top because you're not charting anything. So we could just grab this top line and just say RX renewal.
Okay.
All right, and then from here, I would just have her go to her nurse doc, and I would have her put a comment on there. Okay, so add nursing comments. Patient presented in person, presented in person for med refill, inquired with MD, okay to approve 1 month. And then, patient has annual in
2 months.
Whatever it's going to be. So it's all documented. And then fire right into the medication module and renew the medication. Give her a refill. That's real easy.
Okay.
I make it look easy, huh?
Yeah, it does look easy.
It is easy.
Oh, okay.
Okay, so let's go back home here now. And I'll change this back to a GYN visit here. GYN preventative visit. go back to my well woman. So I'll click in here again. So basically, Leva, all this really does here, and I think the doctors, once they start getting comfortable with the system, I don't fire this template at them right away because I want them to get comfortable just using the templates as they are, unless you feel that they're savvy enough to use this. Because, again, they can stay right here and chart the entire visit because they would start with their subjective, which is everything here. So they would chart. When they're done with that, they would move over to objective. Yep, and they would chart. Look what you got. If I built my well woman defaults in there, I just fire it in. It's great. Did my path. There's my ask, order, enter questions. I'll just put a whole bunch of stuff in there. Say save and close. Then they would hit, of course, bill if they did their path, submit to Superbill. Yeah, I know. I didn't put enough in there. All right, so I'll hit save and close. And then they can move on to right onto their assessment plan right from here. Look what you get.
Same thing.
Yeah, so it's nice. So if they find this will create swifter charting than going down the left navigational toolbar, we definitely want them to utilize this template and all of the functionality of QuickSave, because once they start getting things built in here, it's just going to be amazing for them. It's really going to be nice. I mean, if you look at this, so here's like, Menzies information. Here's associated symptoms. You review
additional symptoms.
Yep. Med search.
Medical search. Go.
History.
Family.
Nutritional. There's your social. There's your confidential. I mean, it's really, really nice. So here's like if I want to get into my pregnancy detail again to add more detail, I can just hit the little detail button here. And it pops up here.
Allows you to go in and make changes.
So it's really nice. But a lot of doctors first look at it and they go, oh, no. But it's because they don't understand the connection between going down the left navigational toolbar and how it works in here yet. Once they understand that, I think this is going to become their template of choice. So I think they can have a lot of fun with it, and they can really utilize it for swifter charting. So, because you know as well as I do, they're going to go in the room and see the patient, and everything's going to get charted after. They're not going to be sitting in the room, pecking at a keyboard while their patient's in there. So that's really nice to have that. So, other than that, for Jen, what is causing you to look at the screen and go, I don't understand it, or you want to go over it again, or are you feeling somewhat comfortable? I think I lost you again, Leva. Are you there? I'm here if you are, Leva. I can't hear you at all. So
I'm sorry. I'm here. I'm here too.
Oh, okay.
I'm sorry.
Okay. So do you have, on the Jen Suite itself, do you have anything that you don't feel comfortable with? Want me to go over again?
Let's see. We started at the home.
When you get lost, always go home.
Go home. Oops. Why I have a blank screen?
Oh, because I did that.
Okay.
All right, there we go. Why is that keep going on? Oh my God, let me just pull the template in. I don't know what I'm clicking here, but why it's doing that. There we go.
Okay. What else? Allergies. HBO. Family history. Okay, you were saying something about the history, past family and social history. If it is that we don't use it on the nav, from the nav, we can use it from the chart, from the
Jen office visit?
Yes, from the Jen office visit.
Right here. All three
on the histories
are on. Yeah, that's the only little perk to the template is that all three of them are on one template. There's
on one template. Okay.
Yeah, there's your family and there's your social.
Okay.
But again, to take your nurses from charting up in here and then firing them down here, I don't know. I mean, you can make that decision. So like I said, if there's
easier.
Yeah, and I think you're going to find that they may feel that just working their way down this left nav, especially if you utilize a practice template to take out things that they wouldn't use in here, it'll shorten this list up. You know, so like if demographics, well, that one you may use because of the pharmacy. But if OBGYN synopsis isn't one, if you don't need them to go to chart summary, vital signs, allergies, but maybe, and review of systems, you could take all those out if you wanted to. So that cleans up that whole left navigational toolbar. And just because you take it off of there does not mean they can't get to those templates. They would just have to do 2 extra clicks to find them.
To find it, okay.
Yeah, but just an option. Okay.
I'm trying to think.
Oh yeah,
if there's anything else that we would need you to go over. We covered prescriptions. We covered quick visit, UTI. We covered colposcopy, biopsies, OB visits.
Yeah, that's next.
OB visits, yes, that's the next one.
Okay.
Because we do have a lot of OB clients.
Oh yeah. So I'm gonna create another brand new encounter because I want to have a clean one. So I'm gonna go new. All right. So we get another brand new encounter for today. Okay, you're still going to be starting at the OBGYN homepage. Right, so I'm gonna pull that in because it's the visit type that's going to drive the templates that are going to display along the left navigational toolbar. So you see you're at the same place, but it's here. So if your patient was a regular GYN patient, but now she's pregnant and she's coming in for her OB initial, that's what you're going to tell the pick list she's coming in for.
Initial OB.
So as soon as I pick this one here where I'm circling, watch what happens over here where I'm circling.
Okay.
All right, so OB initial. And that's right. It doesn't change there. It changes up here.
On the top. Okay.
Okay. So we still have all the components that the nurse can do. You know, I really thought this women now it should be changing over here.
It did, because the final OVS and the soaps are now on the Navi before it was on the top.
Yeah, I know.
In those toolbars.
But I also thought all these were supposed to present over here because we were telling the system. Well, we'll check it, but
okay.
But obviously, because you still should have the functionality to grab any of these tabs from over here. So that's why I'm kind of curious. I'm going to save this and I'm going to close it. I'm just going to kind of give it a kick.
Okay.
Because I did create a new encounter. So let me go back to OBGYN home. All right, and we picked OB initial. That's really interesting because it should be changing to give it another little kick here. All right, and all else fails. You said we have lots of Mary tests in there, right? All right, so let me just open up a brand. Oh, I keep doing that. It's because the tab button doesn't work.
Okay.
All right, so on my computer anyway, with the environment. So let me find another one here. Let's grab this Mary test right here. We don't want the one from 2011. Okay, brand new patient. Let's see if it's going to play nice for me now. So I'm going to come down to my tic-tac-toe grid. I'm going to grab my OBGYN home. And then I tell the system it's going to be a new patient. And my visit type is going to be OB. Make sure I'm picking the right one, but it's OB prenatal initial. It's her initial visit. Okay, I'm going to have to check because this should be toggling over here as well.
Okay.
We are in your test environment. Maybe before we finish training up, we'll toggle over to prod and see if it's playing nicely in there.
Okay.
All right, but we can still work off of this up here.
Alrighty.
All right, so first thing I want to do is in your test environment, I need to go in and make sure that an educational template has been defaulted. Because if we come under education here, and let me see if it's in there. If I go to first trimester, it may already be defaulted for me. Okay, it is. This template is not defaulted out of the box for you, but somebody's gone in and turned it on, so it's there.
Okay.
So we'll just have to make sure in production that it's turned off as well. So let's come back to gestational. Now, really what I want to do is, since this isn't playing right, I want to open up my previous patient because I've got all that history in there already. So there we go. So if I come here and I do access previous patient, I'm not sure which one it is. I'm going to say maybe it's this one. And this should be the one. Yeah, that's all my good stuff, right? Yeah, there we go. So I want to pull that history in. So I'll create another new encounter and we'll start over. It got so muggy here today, these thunderstorms that are coming in. Oof. I was in those tornadoes in Oklahoma last week.
Wow. It's hot on our side, too, but no rain.
Where are you located?
Brooklyn, New York.
Oh, okay. Yeah, but you guys got some really bad weather last week, too, didn't you?
Yeah.
Yeah. I think I heard a tornado touchdown somewhere.
Not in Brooklyn, though.
Okay.
Long Island has lots of rain and stuff.
Okay, that's the OB prenatal initial. Here we go. All right. Yes, are you sure you want to continue? Yes. Okay. So basically what's going to happen here, the patient is a patient of the clinic. She now presents because she's had a pregnancy urine that's come up positive. We've confirmed pregnancy, so she's coming in for her initial visit. This is going to be the most intense visit on here, in addition to the second trimester and the third trimester visits. So once you get through the first one, Leva, you're going to be okay.
Okay.
All right. And now, again, I don't know how much your nurses are going to be charting versus what the doctors are going to be charting. I'm just going to go through all the components in here. So the first thing we're going to do is we're going to say date of first visit, and that's going to be today. Okay. And we're going to indicate she's in her first trimester.
Okay.
All right. You got your
what if a
third.
patient is coming in at her second trimester? Then
you mark second trimester. Realistically, all right, if it's a new patient, all right, any existing pregnancies right now in your practice are going to stay on your typical paper ACOG. They are not going to be charted in NextGen. It's just your brand new pregnancies. If you bring a patient in that's already in her second trimester, but it's the first time being seen there, you're still going to go through all the educational and all those components, right? Okay. So whether or not you pick first or second trimester, if it's the first visit with you all, then you need to make sure you go through all the components so you have a complete ACOG that follows the patient to the hospital.
Okay.
All right. So we come in here now. All right. We indicate her last LMP. We're going to get a little calendar pop-up. So we'll say she said it was, go back a little further here. I'll say it was on May 22nd. April 22nd. So what that does is it automatically calculates an estimated delivery date for you, okay, based on what the patient's telling you. This was my last period. If at the initial exam, okay, we're going to indicate that it's on her initial exam. We'll say we'll go back, and we'll say it was actually the 29th. So it's going to, after we do that, I'm sorry. Initial exam is today. Susan, let's get with the program. All right. And we're going to indicate that she is 8 weeks and 2 days, or 3 days. And that will give you a new new EDD based on that.
Okay.
Okay. However, if she's had an ultrasound done, okay, I've been at OB sites where they'll do an ultrasound the same day so they can get the exact gestational age. So if she had an ultrasound done, all right, maybe she had it done today, and the ultrasound actually showed the pregnancy has progressed, that it calculates she's 7 weeks and 2 days, then it'll give you a new EDD. Okay? From there, an ultrasound center, again, this is a pick list. If you want to, you can edit this pick list to add the different places the patient where they had an ultrasound. From what I have been told, I've worked very closely with Dr. Lanzara. She is an ACOG, an OBGYN who works for NextGen. And she's explained to me that no OB doctor would ever use this field here.
Okay.
She always tells me just to blow by it. And I'm like, well, I need to explain to the client why I'm blowing by it. But that is why. She said usually they don't use it.
Okay.
Okay. But if they did, I mean, you're looking at this is the 18 to 20 week EDD update. So halfway through her pregnancy, you're looking at this and you're going, oh, okay. What's the quickening? What's the fundal height? Does she have an ultrasound? It's totally up to the physicians if they want to use it.
Okay.
All right. Now, if we look at this now, so we've populated when the patient said her last period was. Her initial exam was today. We determined she was 8 weeks, 3 days. An ultrasound confirmed that she's actually 7 weeks, 2 days. So it gives us to see we're all over the place.
Change the EDC.
Yeah. So we probably want to use the ultrasound date as actually the EDD date to be used to calculate in the working EDD. So what you would do is you would take the ultrasound date, okay, which is today, all right, of 6/1, and then you calculate that EDD, and here's what it gives you, all right. So it's adjusted by the Sono, all right, and it's basically telling you, actually, wait, that's not the date we put in. We put in the 1/16. I always get confused on this. Let me bump this up a year. And then we'll go to January 16th. Let me see if I've got it straight now. Okay, now calculate it. There we go. So we calculated it correctly. Now we put in the actual EDD. So
by the sonogram.
Yeah. So as of this encounter, there's my gestational age. Okay. Is it going to be a singleton? Is it twins, triplets? Quadruplets? Oh my gosh. A little bit further down this template, okay, it did pull in, if you remember on the first encounter I did for her, I indicated age, or the onset of her menses was 14. So that copies forward. But these other, of course, are interview questions for your patient. All right, was your last LMP definite? She says yes, then we select definite. Is there a period monthly, and does she have a normal amount, and how frequent is it? And I think this one we could put in, like 28 days. Would that be like normal?
Yeah.
I'm all past the menopause stage. Oh, yeah.
That's in the normal range.
Oh, God, the hot flashes. Woo! On birth control at conception, yes or no. Okay. And prior menses date. So I think, what did I indicate? It was like back in April. I think I said April 22nd. All right. And HCG, that's, I think, a lab test, right? Yeah. So since I put in HCG, is that the check for
It's with the HCG that we use here, it's a urine pregnancy test.
Okay.
By urine.
All right. So that would be today then. Okay. All right. Any diagnostic studies? Now, I didn't add any diagnostic studies on the previous encounter. Had I done that, like if I added in like her last screening mammo, all the information would be here. But I didn't add it in. Nice little comments field. Just some little comments on whoever's going to be charting this first component. And then I'm going to scroll down, and I think that's it for this first one. Yeah. So really the first one is to calculate last menstrual period versus what the exam findings are finding today versus if the patient had an ultrasound. And if that's the case, if you want to calculate the working EDD, we put in the confirmed ultrasound date, calculate it out, and it's going to give us all the information we need. Okay? Now, this little completed little checkbox up here does nothing. But it is a nice visual aesthetic to have on the template that if I was charting this and maybe I had to step out of the room or, maybe the patient had to leave, maybe this wasn't completed. So it's just kind of a little check and balance thing, Lee, but it's really all it does. It doesn't trigger anything. It doesn't do anything. It just says, I completed this first tab.
Okay.
And it changes my little X to a green check. Now, the next two ones are the biggies. Okay, so let's get into medical summary. All right. And anytime you want to stop, I'd like to go to like 4:30 if you're up for it today, because we're going to get back together tomorrow.
What time tomorrow?
I think they got us for 9. Let me check my calendar. Is that okay?
I don't think 9 is okay because we have a meeting tomorrow. I think we have to coordinate it with Val.
Okay, let me see. I've got you scheduled from 9 to 11:45. I mean, realistically, we're going to get through most of this today, so if it's just an hour for follow-up for questions, that's fine.
Oh, okay.
You let me know whatever's good for you, okay?
No problem.
Okay. So here I am now on my medical summary. So now, as you can see, my total pregnancies have increased to 4 because I've indicated now that she is pregnant, whereas before she was 2 full-term, she had 1 spontaneous abortion, but now I've indicated she's pregnant, so now it's...
So it added another one.
It added another one, okay? And again, here is that history that I did earlier on the other encounter. Okay, so there's my past histories here. You could, in here, if you needed to change any of the gravid and parity here, I mean, that's totally up to you. If you do click in these fields, you get a little numbers pad. So if you had to tweak it,
make
update
any changes.
Yeah, and it'll just update all the grids everywhere for you.
Okay.
The past pregnancies, it works the same way. If I click this Add Detail button here, all right, it's going to launch. It's pretty much the same template, only it's got a little bit more. It's just on a different pop-up. Excuse me. It's just got a little more information down here to add detail to. So if you look at it, epidural, walking epidural, spinal. So if you wanted to add a little more detail in regards to this on them, where you don't have this on the other template, you could. But everything else on here works exactly the same.
Yep. Number of pregnancies, months, gestational weeks, birth weight.
Now let's test something here. You wanted to know, do I only have to, if they don't remember any of this, but that we knew they had a female, and the baby was born, we'll say in August of 1961. Okay. Let's see if it's going to let me save it. Yep, sure did. Okay, so if that's all they know, that's fine. So we don't have to put in the weight and all that stuff. So there it is. That's my birthday. Okay, so there it is right there. And then, of course, this would be the unknown pregnancy because it was a miscarriage.
Okay.
Management and complications due to pregnancy. Again, this is pulling from another template. I don't think, or can we add it here? You could add some obstetric history in here. So, like if her pregnancy number 1 was causing some issues, and her issue was maybe gestational diabetes, and that was in like 2009, and what the management was on drug therapy, and her outcome. You know, it really, unless you really want to do more, and a little comment field, but that'll let you build some obstetric history, just in case the doctor obviously would need to know that. So again, real easy to use. Now, down further, this is one of those real long templates. We just went through page 1 on this template because you can see that was all that was in our view here. But now we could go down to page 2 of this template. Okay, medical history and STI history. So if I click that, it just shoots me a little further down the template. Actually, it's taking me a little too far down. I need to get back up here a little bit. All right. So, histories. Right here. The nice thing about this, though, Leva, is they have this default all to negative. So I don't know if your patients are still filling out, any type of questionnaire, or this is going to be part of the interview process. So this is where it can get a little lengthy. But these default all to negative is actually going to default everything in here to negative, this whole part of this template here. Okay, then you could go in and chart any exceptions. And maybe she does have diabetes. Okay, and maybe there is, some psychiatric problems, whatever the case may be. All right, so that's nice to have in there. Just a little bit further down, the additional screening questions, the TB, exposed to TB, genital herpes, and rash or viral illness since last menstrual period. We can default those all 3 to negative, and it also defaults over on this side too. Nice little comment field for your nurses if they're the ones that are actually doing this part. OB infection history comment. So if we just had to add a little bit of history in there. Okay. Then allergies. This is shared from her other, her regular gyn visits. So there you can see are all my allergies as well as family history. So this, again, if I had to make any updates to this, We indicate if she's got a latex allergy, yes or no. But if you wanted to add allergies, just click the little add allergies and look what you get. And you've seen this already, so maybe we could say she's allergic to ibuprofen now, and she gets some GI bleeding. That adds it in. Same thing for family history. All right, add detailed family history. It's the same template you saw earlier. Okay. Cancel. We don't have to add any more there.
Okay. Let's say it's the established client with all of this information in there. Does it transfer onto her OB chart?
Yes, ma'am.
Yes, it does. Okay.
Thank God, huh?
Then you don't have to ask them over.
Oh gosh,
any family history, and they'd be like, I've been here for how many years?
Insane. That would be insane, wouldn't it?
Okay.
Okay, so a little further down, just a field here, symptoms since last LMP. If we click the little add button here, this allows us just to pick, it's a little, just check boxes. Maybe there's been some headaches, maybe there's been some nausea, maybe there's been some breast tenderness, a couple of the most common things in the beginning.
Right.
So we click OK, that concatenates into the field for you. And I do believe you can still space. You can also free text more. All right, so you're not limited to just what's on that little pick list.
Okay.
And then medication since last LMP is completely free text. Okay, so if you have to add in there what med she's on, then this is where it has to go. Okay. Okay, then we go down just a little bit further, and here's that genetic screening and the teratology counseling. Okay, these are all the things that are discussed, during the first trimester. So we look at this again. You've got a default alt-negative option in here. All right, it's automatically going to, indicate if the patient is 35 years or older at the estimated time of delivery. Okay, but again, we can still fire all these in as a negative, and then chart any additional exceptions or additions. So, of course, this would be for mommy-to-be. All right, so if there was anything in here that needed to be changed. And then here is some family history, babies, mother patient, father patient, any relatives. So if any of this was applicable, if there was maybe a little congenital heart disease, okay, anything. Okay. A little bit further down is any medications, including supplements, vitamins, herbs, any recreational drugs, so on and so forth. Again, these are two fields that are free text for you. And now we're almost done to the bottom of the template. Okay, again, we have default alt-negative. These are the risk factors now that'll be, discussed with the patient. So again, you can default them all into negative and then chart any, exceptions. So if she's, maybe she's C-section, let's see what else, maybe excessive weight gain. I don't know, just whatever little items in there. But one of the most important things here is this field right here for risk level. So after all of this first template here, tab 2 that I'm on here has been charted, you have to indicate the risk level. Is your patient at low, moderate, high, or very high? We'll just say she's at low, and then you can indicate that the first trimester has been completed. Okay. And then a nice little comments field at the bottom for any comments you may want to add. So once this is done, I'm going to scroll back to the top. Oh, come on. Up. Keep going. Almost there. There we go. Okay, so now I can indicate that the medical summary has been completed. Any questions on that one, Leva?
No.
Okay. Let's move over to OB Social. Again, this is going to, a lot of information on this template will pull from the social history template in the GIN suite if I had, populated over there. For example, there's my asbestos, okay? But I didn't indicate language at home, birthplace, any of that. So, again, I think you're going to have to scrutinize, that social history template in conjunction with the OB suite to determine okay, she's a GYN patient now, but she's in her childbearing years. What information on that social history would be pertinent to land in this OB suite if your patient becomes pregnant? So, again, it's going to, maybe a little bit more addition on the GYN suite, but when you get to the OB suite, all of this information will be living with you on this template outside of some additional fields. So, again, I didn't populate any of these. I could if I wanted to. I could click in here and get a pick list, and fill it all out here. And if I fill it out here, it's going to fill it out after she delivers and then comes in for, our regular GYN visit. Okay, but I didn't actually, put much in here. The only difference on this one is this set of fields over here. Okay, we have baby father. Okay, so, free text field. Phone number would all be free text field. There's a support person, sister, and their phone number. Okay, and we'll say they're Native Alaskan. I always like that. And do they have a pediatrician selected? Okay, this again, Dr. Baby, the free text field. Do they plan on taking prenatal natal classes? Are they planning on breastfeeding, bottle feeding, or both? Does the patient agree to a blood transfusion? That's going to be important in case there's any complications during delivery. After this baby, do they perhaps desire, have a sterilization procedure performed? Okay, if they have consent on file for that. Antepartum anesthesia consult planned, maybe yes or no. And are they planning on enrolling in WIC? But pretty much everything else on this template is on the other social history template, Leva. So you can see there's the tobacco, there's the alcohol, there's the caffeine. There's the illicit drug use, and I indicated on the initial OB tab here on this one that there was. If lifestyle is important, is your patient exercising? Again, if I filled it out in the GYN visit, it would have carried over to here, as well as firearms. And the other one is, are there cats in home? All right, so because who's going to be cleaning that, litter box? And you can also get to the confidential information, that confidential template as well. Okay? So there we go. It takes us right into here. So you can see everything that I charted previously on the previous encounter on the confidential template is living on this link here, but it's in my OB suite now. So I could change, add, or update anything if I needed to. Oh, see, here it is. It's playing nice with us now. Do you see that, Leva?
Yes.
Okay, I don't know. It was just being a little pokey on me or what was going on.
Yeah.
Okay, but it seems to be, yeah, okay. Oh, my goodness. All right, so I think, again, these are pretty clear-cut, and, you were trained on these last week, and you got kind of a reintroduction to them today. So,
right.
I can sit here and say it's simple, but once you do it a couple times, you're going to see it's very simple as well. So we can, again, say that this part was done. Now let's talk about lab results. Okay. Now, the thing about the labs in here, okay, if we were going to order labs for our patient at the first trimester visit, okay, we could come here, right here, to order labs. And this is the way you definitely want to do it, because the lab template that's going to launch for you is very specific to the OB suite. And you'll see what it's going to do. So when I click on order labs, all right, it takes me to the lab master. But you can see here, I can actually order my first visit labs here. Of course, I haven't got a assessment in there yet, so let me get an assessment in there. So we're going to say pregnancy, where would be? I know it's on here somewhere. See, even I don't know where everything is. But I know it's on here somewhere. We'll just say, I'll just put on twin pregnancy. There we go. Okay, save and close. All right, so there's it is. So if I'm going to be ordering my first trimester labs for this patient, all I have to do is come in here and say first visit and look what it does for me. It checks everything off. Now, when you look at this, if you don't do all these labs, that are on here, you'll have to scrutinize. Whoops, stop, template, stop. If you don't do all these labs that you see here, then you just simply unselect it. Okay, maybe we don't do this one, so we just unselect it. All right. If none of this, if this is going to create more unchecking than checking, then you could just basically come in and select them yourselves. But the last thing you have to do is hit place order, and that's going to actually place the order for all the labs. Now, I don't know how your workflow is in your office. If these are ordered, then obviously a requisition is going to be created, and the patient's going to get sent to the lab. Or do you have an in-house lab by any chance? Leva, do you have an in-house lab?
We use Sunrise.
Okay.
They go outside, so I think it's going to be
generated. So you're generating requisitions, right?
Yes. Yes.
Okay. I would still order them here in NextGen. I don't think, again, tasking, I get sometimes a little overprotective about tasking, because if the doctor is ordering this, the nurses know what needs to be done. So I leave this totally up to you. But again, if we want to cancel that task out, we just hit cancel. My lab order's been placed, but I haven't tasked the nurse, because when that patient gets ready to go through the checkout, the nurse knows, okay, here's your first trimester labs you got to go for. Now, when I clicked on order labs, it actually took me to the orders template here. So here's lab orders, office injections, diagnostics, and referrals. I need to get back to my lab template in the OB suite here. So that's why I can come click it right here. All right, and that'll actually take me back. Okay. Now, the thing about this template, though, Leva, is even though I've ordered them today, okay, when the results come back in, are you going to have a lab interface? So in other words, when the patient goes, are the results going to come back into NextGen electronically, or are you going to be getting those results faxed, or you're pulling them off of the company's website? How are you going to be getting those lab results? How do you get them now?
Right now, they print it out. They send it to us every morning.
Okay.
Through the printer. We have a Sunrise printer.
Okay, super. Okay, so here's what's probably going to happen for labs. All right, the labs. If these are all the first initial labs that you do, okay, and you've got the piece of paper back in your hand. All right, and you've got all the lab results. If you want this template to be populated with the lab results, it's a manual process. So what I'd have to do is I would have to come in to each and every field and put the results in of the test.
Okay.
All right? But at the same time, you're also going to be utilizing the imaging control system, correct? You're going to be scanning. Leva?
Yes, ma'am. I'm sorry. Go ahead.
Okay, you're going to be scanning documents into the system?
Yes.
Okay. So this is your choice for everyone there. You can decide. You can scan the results in, so the doctor would just have to come into the patient's history. All right, and there goes my WebEx. Let me see if I can get it. There we go. It could be scanned in and living over here in a category called labs. So he could just click on it and review the actual lab runtime right on the screen. So it's going to be your choice to come in here and add them in manually and scan them in. Again, it's going to be up to you on how you want to handle that. Okay?
Yeah.
All right. And I've got to make my little WebEx thing. Let me turn history off again. Go away. All right. Go away. All right. So you can see here what I'm doing. I just start clicking through all these individual fields here. And I'm putting, the results in. All right. And then once all the results are in, all right, so we can default all completed dates of today. I can do that. Oh, come on. Let me get that in there again. So today, click OK. So it defaults all in. Then I just have to put the results in. And then if the doctor were to review this, you come in and look at all this and then indicate that they've been reviewed, and that checks them all off. All right. So this is optional. So if it's not necessary to fill this all out, because the document will be scanned in as part of the patient's electronic health record, again, I'm going to leave that up to all of you. But once the labs are done, we'll hit completed. It's up and received. Oh, okay. Patient may need RH. Where is it on here? I know I'm an RH negative. See if I can take it off of there. There we go. Okay.
Okay.
And if you want to include all of the lab documentation in the ACOG per se form, we can tell it to do that.
Okay.
Okay. The last big thing in here, and actually the OB suite is actually, once you get through the bigger tabs from a trimester level, really fast visit, super fast, unless your patient's having issues. But the education, all right, so we have first trimester, second trimester, and the third trimester. So when you educate your patient, you're going to click on this active text link here, all right, and that's going to open up like I was checking earlier. So we can come in and say, okay, yes, we educated our patient on all of these factors here, all these educational items, anything that's done. Unfortunately, not quick save functionality. This is a lot of point and clicking, but that is what it is. Anything else that we perhaps discussed with the patient that's not available here from these items to choose from, we do have this free text field. So after the education is done with patient, we can say the first trimester educational documented as complete, and we click OK. And that's going to pre-populate the grid behind here. So there's everything right there. So that's first trimester. Then, of course, as we get through the other trimesters, you would do the additional. And then really, outside of the last two tabs, this last tab right here, because encounter detail, I'm going to discuss with you, and you tell me how it works in your office. This really the last tab for the visit. It's going to pull in, as you can see, we have all the information. It's got my patient's age, her risk level that we did, her gravida and parity, her working EGA, her last menstrual period, definite, everything's already in there. Now, what's different on this one here is this. Okay, now, we didn't do vital signs, which, of course, vital signs would have been done. Okay, but even with vital signs being done, okay, we can say our patient is 64 inches tall. This is a manual process, but if you want to watch the weight gain as the pregnancy progresses, you have to do a little manual manipulation at the first visit here. So I'm going to say she's 64 inches tall. All right. These next fields here, I come in here, I'm going to put in her weight. We'll say her pre-pregnancy weight was 115, okay? And that was on, I'm going to go back a month, all right? And her last weight here, okay, I can't get into these fields unless I do the vital signs. Because it's going to pull from that. So let me come over and just fire in. I'm pretty sure it's going to give me her weight, but let me see. Actually, I may be playing games with you here. Let me put in 110 and just hit save and close. We may have to do it a different route, but we'll see. So I'm going to come back over to my left nav, and I'm going to go into my prenatal details. Okay. There it is. So you see what it did? It pulled from the vital signs. So when you add vital signs in, we can do, you put in their last weight and then what their pre-pregnancy weight was. It'll start to calculate over the months what her weight gain is. So if I came in and added another, different weight, it'll calculate out. And I'm kind of surprised because I have pre-pregnancy weight of 115. Last weight was 110. Okay, so yeah, there wasn't any weight gain because she actually lost weight.
6 minutes.
Okay. Let me change that. I'm going to make that a bigger. I'm going to get a bigger number. I'm going to make it 125. So back that out. 125. Hit save and close. And let me get back over. Let me. still. Okay, so there you can see what it did. It's told me pre-pregnancy weight, so it's giving me a calculation. So that's how that works there.
Mhm.
Okay?
Yep.
So basically, here was the data for physical exam, prenatal records sent to labor and delivery at, okay, you have to add your hospitals in there where it's going to go to on this pick list. Okay. Down here, right underneath that, this is just a little more detailed as far as your vital signs and whatnot. You can add vitals right here as well. If I double-click in this grid, okay, it launches up a template where I can put in, blood pressure, weight in pounds, fetal heart rate, the fundus, patient having any pain. This is actually kind of nice. So I can say, like 125 over 85. There's her weight, fetal heart rate. I don't know what a normal fetal heart rate would be or what this would be. No pain. Presentation, the baby is transfers. There's no edema, no albumin, no glucose, stone on her urine. All right, membranes intact. Anything else that you wanted to, add in here, some little comments. Save vital signs in urine dipstick. Save and close. And this is just going to pre-populate the grid out here for you. All right. So that's nice. Now, as far as adding like any comments, we're at the first trimester. This is the first visit. We've gone ahead and charted, all of these different tabs up to here. On prenatal detail. This is where problem and detail, moving forward now, Leva, for every subsequent visit, except for those trimester visits, the second and third. When the patient's returning, coming back to the practice a month later, everything else is pretty much done on here. It's going to be, a quick review of things, maybe something changed in history or whatnot. But in all actuality, it's coming down here to this problem detail and double-clicking in the grid. And we can indicate what the problem is. So maybe she's having some headaches. All right, and I can also date stamp it. All right, then this is all going to be free text data. This is what builds that ACOG after you do the initial components. So this is where the doctor can write, put any kind of note in regards to the pregnancy. That becomes part of the ACOG. So it's really nice. So I'm going to hit save. So if the patient's having maybe some multiple problems, we could say clear for add, and it'll give us another one. Because the way I remember that ACOG form looking, when the patient came back in for her subsequent visits, you would just write the date down and then any details to the prenatal visit, correct? Okay, so this will all build in the grid. It just continues to build. You'll never lose her problem list from visit to visit. And then basically at this point, I've added in that she's pregnant. I haven't done any other labs or anything. I could order more labs if I needed to just by clicking on labs here, and you're going to see where it's going to take me. It takes me back to those labs. Come back over to prenatal detail.
Specialty code pharmacy.
I can also get to my office procedures, my diagnostics and procedures, and I can also get right to my plan, which is the same templates that you've been seeing all along here. So,
all right, I have a question. For our OB clients, the initial visit, not initial visit, but their next visit, we usually do the vitals and the urine dip.
Okay. What we'll do is we'll finish this one, and then we're going to pretend she's coming back in for a follow-up, and I'll show you the steps you can go through.
Okay, so on the initial visit, we put it in the same way that like we went in and do the dip before.
You can, absolutely, yes.
Okay.
Yep, right from nurse doc.
Yeah, okay.
Yep, absolutely. That's what I say. Your nurses are going to love that template, Leo.
Okay.
Yeah. Now, after, so again, we've charted this as it was the initial visit. I'll talk about encounter detail in a minute. I'm going to generate the ACOG, or what we call in NextGen the prenatal record.
Okay.
All right, and it's going to ask me a couple of questions. It's going to want to say, it looks kind of funky once it starts to run, as you can see what it's doing. But it's a much different report. It's actually a crystal report. It's not an NGN document like you saw in the Gen Suite and you saw in the Intake OV. Look at this. Is this beautiful or what? All right. Of course, we have to get the NextGen logo off of there for you in the environment. But if you scroll through this, okay, here's page 1. So everything is on here. You would use the little arrow forward now to go to the next page.
Right.
Okay, and that's all their infection history. Everything is on here. We had actually one of our doctors actually created this new one for us, and I was jumping through hoops when I saw it because it is so much nicer. This replaces that entire ACOG that you have to fill out.
Oh, okay.
Yeah, this completely replaces it because what's going to happen, you'll see when we create the next encounter. So, here's her allergies, there's her meds, there's her EDD stuff, her OB problems. It's awesome. Sorry, I get excited sometimes. Because I haven't come across one OB doctor yet who hasn't fallen in love with this document here. Because when this patient is ready to deliver, this just gets faxed to the hospital.
Right. Okay.
So everything's in here. All right, let me close this crystal report. All right, let's pretend now. Okay, so she's basically, we'll say she's done. So we want her to come back in the office within 1 month. Okay, so for her next visit. All right, so on 7/1 she's due to come back in. So I'm going to save that. So there's part of my order. Okay, so here are all my orders right down here at the bottom of this template. There's all my labs, all my risk factors, everything that I did, and we should see my order to ROV right there. Okay, there's a return office visit for 1 month. Okay, bye patient, call us if you have any problems. Okay, we're going to save all this. All right, and what I'm going to do is I'm just going to close this. All right, it is a month later, and the patient has presented back to the clinic for her next appointment. So you're going to, from the inbox, you're going to access your patient's chart. You're going to right-click, and it's going to be OB follow-up or however you've got them. The naming convention is going to be. You're going to right-click and go to the chart. The encounter will be sitting in there for you, ready to roll. Okay, so I'm going to go to history, and I know I keep using the same one, but I'm going to minimize this one. I'm going to create another new encounter. Yes. All right. Coming in from my follow-up. We're going to go to the templates from the tic-tac-toe grid, and I'm going to pull in the OBGYN home. Second visit, follow-up to her pregnancy. My visit type is going to be OB prenatal.
Okay.
All right. So basically, the easiest way to do this, Leva, is, again, they're going to be grabbed by the nurse first, obviously, so we're going to start the tracking process that this patient is with nursing. Okay, and they're in exam room 1, whatever it may be. She's going to follow her process flow down the left nav, which is probably going to be, basically, I would just fire her right to nurse doc. Yeah, and have her put in the vitals. She's going to review the allergies. She'll review the medications. Do you do a second urine dipstick when they come back? Or?
Yes.
Okay, so we could go ahead again, order the dipstick here and result it for the doctor. And then, of course, anything else. And then histories, is she going to be updating histories at this visit?
No.
Every visit? Okay, so really just nurse doc, do you think?
Yes.
Awesome. All right, so let me just put a little information in here. So I'm going to say that I'm going to just put in that she's 64 inches, and now she weighs 130 pounds.
Okay.
She's been eating a lot. All right, that all looks good. So I'll save that there and close. So I've got some more my vitals in there for my next visit here today. Nothing's changed. Allergies reviewed, no change. Everything looks good. Nothing else I'm going to do on there. So now She'll change her status. She'll track the patient to being ready to see the doctor. Okay. Did I actually go into a real page? Oh, it's in there. Cool. So waiting to see provider. So on save and close, that's going to upload. That's interesting. Is Mary Test in there? Huh, okay. So when the doctor goes in to see patient now, their starting point from the left navigational toolbar is going to be prenatal detail. So for all subsequent visits, so here we go. Uh-oh, now she's gained 15 pounds. All right, so it's giving me the vitals that were added. This is where the doctor's going to go. They're going to come right down here to problem detail. They're going to double-click here. All right, they're going to say, and since I'm doing this all the same day, it's in there, so I'm going to save it and just say clear for AB. But this is how it would look. So we're going to say the patient coming in for fetal movement. I would date stamp it. I'm a big fan of date stamping. And then type their notes, okay? If she's having multiple problems, we're going to say save, clear for add, come back into the problem detail, and say maybe she's also having some nipple discharge. Okay, stamp it, type your notes. This is what builds the whole ACOG, and I'm not too worried about my tuples. In this problem detail, if what you're looking for is not here, grab the free text line and free text it in.
Okay.
Okay. Date stamp. Okay. Basically, wash, rinse, and repeat, my dear.
Okay.
And revert. All right. So that's how they're going to build the monthly visits. They're going to be coming right to prenatal detail. They're going to, again, review anything, update anything, whatever they need to do, but then they're going to fire right down to the problem detail grid. And that's, again, here what's going to build it all. So see, it'll have the date for each time a problem was noted. Okay, and then they'll generate there. Okay, and they actually don't even have to generate this prenatal record. This can be generated at the end of the pregnancy, but if they want to look at it, they can most certainly, generate it for each visit. I actually have not gotten feedback on my OB doctors. Do they just generate it at the end? Are they generating it every visit? Because it's going to overwrite the previous one, so you don't have to worry about, any data loss. It's just going to add to it anything we add. Now, let me see. I don't know exactly where the problem detail comes out, but let's take a peek. So we're on page 1 now. And this crystal report is going to get pretty large. Because it's going to be documenting, especially if there's a lot of problem detail items in there. I think it's toward the end of this document. All right, so there's that. Patient request, headache. There it is right there. There's the problem list right there. Okay. So this will keep pushing everything down. And you can see how important that date stamp is?
Yeah.
This would be 6-1. This would be 7-1-7-1-7-1. Excuse me. Then the next one would be 8-1, 8-1, 8-1, 8-1. So that's what it'll build the whole OB problem list. So this is already page 4. Page 5. I think that's, nope, we got one more. Page 6. So this ACOG, just for what we did right now, is 7 pages long. Okay. What questions do you have?
Questions.
We're going to talk about that encounter detail next.
Okay.
Okay. But actually, so when you look at this, it's not really as detailed as it looks, is it?
Yeah.
They make it, when I first looked at it, I put my heads on my head and I went, oh my gosh, what is this? But then when I actually started charting like a OB initial visit, I'm like, wow, this isn't bad at all. Really quite interesting.
At the bottom here where it says notes for this visit, urine, district detail. Yes, that's for
if you click on this, if I had filled this out, let me go back over to Nurse Doc, and we'll go to Office Diagnostics, and there we are right there. And I'm going to order this one right here. So again, I'm going to go to Detail, and I'll go ahead. This is the same little pop-up. Now, does this get billed too at the visit or no? I don't know if this gets billed for, Leva.
It does.
Okay.
It does
So
get
after
billed as part of the visit, part of the
Okay.
prenatal visit.
All right. So after it's documented with the results, the details,
You
submit
submit it
to
to
bill.
Super Bill.
Place the order.
This work?
Now, let me close that out. So now, if we come back over to prenatal details, and we come into urine dipstick, there it all is.
Right.
Okay, and then the prenatal record comments. This is just a big free text field for more comments. That's all this is. All right, so just a nice big comment box. And then actually down in here, this is also 100% free text. So if there's anything else that needed to be added, you can utilize the prenatal record comments or just this little notes field down here.
Oh, okay.
All right. Let's see, patient concerns here. This, I think, this is just if you double click in the grid, if the patient had a concern, like such as circumcision, we could save it, clear for add. If she is also concerned about stem cell collection, save, clear for add. So this just lets you document on the record that the patient is having some concerns about this. That can be addressed, throughout her pregnancy. All right, so when I save and close, whoops, let me add one more thing in there. Come on, there we go. Yes. All right, there we go. So it just kind of highlights them in red too. I wish the grid was a little bigger because you can see I added quite a few things there, so I had to do a lot of scrolling, but hopefully it won't cause any issues for you.
Okay.
All right, and a little bit further down, what else do we have?
Question, clients for cerclage. If the provider has to document it, that the patient is here for cerclage to be removed or...
What is it to be removed?
Cerclage.
What is that?
Something they implant into the cervix in the beginning of the first trimester if they have patient on short cervix. Yeah.
Oh, okay. Oh, yeah, my girlfriend's daughter just had that, but she still lost the baby.
Yeah.
Geez, that's a good question. Let's see. Let's go down here. All right, because we do have diagnostics and procedures here. So let's go. Well, actually,
notice it's on there.
Yeah, I wonder if it would be. Let's just look.
Cerclage is like an implant.
Is it here?
No, I don't see it.
Okay, but it would be actually a procedure, right?
It would be.
All right, let's look there. I don't.
Biopsy.
Well, while we're saying that, you're going to have to tell me. I'm going to email my favorite, Dr. Lanzaro. And if she's not busy with a client, she's the one that helped develop this whole suite. All right, so how do you spell that?
Yes.
Okay, I'll just put implant.
Implant, C-E-L, claw, L-A-R-G-E, large,
Okay, I'll put a question mark after it. She'll know what you're talking about.
Yeah.
All right, question
I
mark.
think if the doctor has to discuss with the patient that, she needs to have a cerclage because she has the shortening of the cervix and it could present with spontaneous abortion, and they usually discuss that with the client and do it in the hospital. But in the office, we have to document it, and they do come to the office to have it removed.
Okay.
So,
patient procedure done in the hospital.
However, removal is done at the office.
Okay. I'm just typing her in this email. It's done at the office. The office. How?
Because it should be somewhere here under the genitalial, because I see the pessary and the biopsy and...
What is...
I've never heard them call it by any other name, so I'm not sure.
What is the best practice for charting this in the OB suite? Okay. like I said, she's real good about getting back to me. And if she doesn't get back to me right away, she'll definitely get back to me tonight because that woman's an email hound at night.
Oh, okay.
Hi, Dr. L.B. I just love her to death. Okay. Patient, it's for a patient that has shortening of the cervix. Procedure is done in the hospital. However, the removal is done at the office. What is the best practice for charting this in the OB suite? Okay.
Good.
So get back to me on that. So I hope she doesn't come back and say this template right here. But actually, it wouldn't be that bad because you could build a quick save for this. You could put in what the description is. We could get it added to. Actually, the indication would be for shortening of the cervix, and then in the procedure we can add to this database pick list here exactly what you're doing.
Okay.
All right, so we could put that procedure in there, and then was the anesthesia used? So you could use this.
Could create it, yeah.
Yeah, I have a feeling that's what she might come back with, but we'll see.
Okay.
Well, we'll hang tight on that one until she calls us. She emails me back.
Okay.
Okay, back to prenatal details. Any other questions on that line?
Not right now. That's anything I thought of, really.
Well, like I said, you're going to go home tonight.
And brainstorm.
Yep. All right, so same thing would follow. Basically, what's going to happen with our little patient here, too, is the assessment's going to copy forward for every visit because she's pregnant. So really the only thing that would have to be done here is if any additional labs needed to be ordered, any additional office procedures done, diagnostics procedures, the custom plan, if anything is done from a plan perspective during the visit, and then when do we want her to return. So usually it'd be, once a month unless she's getting to a point where maybe she's high risk.
Okay.
And then you save it to the grid. All right, so there's all our orders. Now remember, all of these orders, everything we have done is here in order management.
Okay.
Do I love it? Because again, this lets a nurse come in. Like maybe this patient is coming in this afternoon, and we need to go in and see, okay, what's been done, what's not done. Oh, okay, I see we got to get this done, we got to get this done, we got to get this done. So it lets her go to this one-stop template to look at all the orders for the patient.
Okay.
And what else is really, 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 really cool? For the initial visit, if you use the checkout, all right, and I don't have any labs on this one. I don't know if you're going to use this or not, but let me see. Yeah, I have no labs on this one. I have it on the previous encounter. Let me go open up that one. Don't say no to this. All right, everything closes good. Come back to my history, so it should be on this one here, yeah. So let me just go to OBGYN home. And this was the OB initial where I ordered all those initial labs. If I go to checkout, just trying to think of anything to save you time. There's all the labs I ordered right there. Look as you can print, honey. If your lab will take this, you can actually generate a lab requisition right in here. Ooh.
Okay.
All right.
Okay.
It needs a little tweaking. Put your logo on it. Put your address on it. I think you also need your patient's social.
Yeah, more information from the patient.
Yeah, but that's real easy to do. But it lists all the tests, why they're being done, and then all the tests. Oh, she already emailed me back. I told you. What did she say? First, she's going to correct me on the spelling. It's Cerclate, C-E-R-C-L-A-T-E. If this were removed in the office, I don't believe you can bill for it. It should be included in the global fee. Would just put it in the common sections of the OB flow sheet that I did it and what the cervix was like after the removal. She said, I thought you could bill for it, but that's a big if.
Okay.
Okay, here we go. You could use the generic template to submit the super bill if you like. So
that's the same template that the same one that you showed me.
Yeah. So she's saying either just use the prenatal detail and document what you did if you don't bill for it. So write down in here problem detail, or go to the procedures template and utilize the generic template if it is something you bill for. Okay?
Okay.
All right. All right, let me get back out of here. I'll say yes because I want to get back to my other my later encounter here, which is this one up here. So she must be working out of her home office. All right, come on. All right, go get you. Gosh, it is pouring here to beat the band. All right, so I'm going to come back over to my prenatal detail. And let me go ahead and make history go ahead. All right, so again, on prenatal detail, this is where most of the charting is going to happen, or really all the charting is going to happen on LEVA for the subsequent visits after the initial.
Okay.
So patient comes in, the nurse will do her component. She'll indicate that, again, the most important thing is the visit type that we have to make sure that we pick that it's the next OB visit, so that this left navigational toolbar displays the proper link so the doctor can then fire right into prenatal detail. If they have to go back, they can go back and hit on any of these templates, but this is where most of it's going to happen. Let's go back down the swab, make sure we didn't miss anything here. That's really about it on this one. Now, if your patient is coming in for their normal monthly OB check, and another problem is discovered, like maybe diabetes or maybe a rash outside of the pregnancy, do you usually, I know you're not billing for this visit because this would be the patient's prenatal care, but if she's got a separate problem, would you bill for that?
Yes.
Okay. That's what this last tab on here is for. Okay, so if everything's fine with the pregnancy, but she says to the doctor, oh, by the way, I'm having this, they would then utilize this encounter detail button. And this is a top-to-bottom template to chart an issue outside of the pregnancy. And if you look at it, it's really like a condensed version of,
a routine exam.
Yeah, like a problem. Like maybe they're having some reflux. To me, that would be associated with pregnancy, but hey. All right. HPI dispute complaint all works exactly the same. Okay, this is actually giving me a generic. I always pick a dang generic one. Why can't I just pick a normal one? Let's do sore throat.
Okay.
Did I not grab sore throat? Come on. Sore throat. There we go. HPI dispute complaint. This, I think, has a quick visit. Oh, wow, they're all free form. All right, well, again, when did this start? So she's pregnant, but this started 3 days ago. All right, the duration really wouldn't be applicable. The location's in the throat. Say it's pretty severe and it's constant. Usually when you get to that point when you're talking to your doctor, it's pretty unbearable. But it's acute, and the status is that it's gotten worse. So you got the my phrases, or again, this would just be free text to the HPI. All right, so she's got her little sore throat going on. So here you could do your review of systems. The only difference here is there's no quick save functionality here. If everything's normal, you check the checkbox. All right, so if the doctor just was looking at these 3 things, but then head, ears, eyes, nose, and throat, he looked at her throat. Oh, something's going on. Maybe just a little bit of, strep starting. You could go ahead and indicate what's going on with the nose and throat. Okay, so that maybe she's got hoarseness, pharyngitis. At this point too, he may want to order a rapid strep. So we could go to, office procedures and order that rapid strep. Actually, it would be a lab.
Okay.
So we come in here, we should see, where is it? Other test, additional labs. Actually, it's a point of care test. So it wouldn't be on this one. Office. Shouldn't be on this one either. There it is right there. Throat culture. All right.
Excuse me.
So we could place the order for the throat culture so the nurse could swab, and then she could actually result it. Okay? Or she could go back. That may be a standing order that you want to create in the nurse doc. So if he instructs her to do a rapid strep on her, we would do it the same way that you did it from the nurse doc with the urinalysis. We would add, rapid strep for screening for, pharyngitis or something.
Okay.
All right, so that could be, I like to keep my nurses all on here if possible. But if the doctor ordered it, Okay, if he ordered the strep, so there's my throat culture there. If he said to her, hey, I just did a throat culture, take care of it for me when it's done, she goes to her nurse doc. There it is right there. So either if she orders it or he orders it, it's always going to land here. So at this point, again, I could double-click and result this test right here. I could say that it's been performed, received, completed, and the interpretation is that it is positive for strep. Submit the super bill. Save and close.
Okay.
Okay, so that's all that back and forth. So they can see there it's completed. The doctor quickly, of course, he's going to ask his nurse, what were the results? She's positive. Or, he could come to order management and just look at the strep test in here if he can't find her. And that was an office service. All right, so, I just saw it. Just flashed by me. All orders. Maybe I can get back to it from there. Trouble. You can filter on these, too. If you just click on the header, it'll filter them out.
Okay.
So that was it's in here. Culture urine, but you'll be able to see the results right here. Positive. There it goes by me again. There it is. All right, so let's go back over to encounter details. Okay. So again, they would chart the review system. The second part of this, of course, would be the exam. If it's a focus visit, outside of the prenatal visit, I'm having a really bad sore throat. Probably only going to do, a couple of things here. Maybe they're going to check the ears, they're going to check the respiratory, and whatever else they were going to do. It'd be pretty limited. But outside of the pregnancy now, if they determined that I did have, say, pharyngitis, if I go to add a common assessment, it's going to fire up the OB suite, which I don't think you're going to find pharyngitis on here. Because you can see anemia. Yeah, that could go along with pregnancy, though, but let's look. Okay. So it's not on this one. So I could come into add or update, which is the one I kind of like better. Okay, because here I could actually come in here. First of all, she's had a history of it. I could just pull it from here. All right, so she's had pharyngitis in the past. I could come right here, and I can just say, I'm going to say starts with, because I believe it's actually in there as pharyn. I'm going to put it like that and run a search. Acute pharyngitis, there it is right there. So what's really nifty here now, Leva, is if I select this, okay, it gives me as a second assessment. Here is where I could just say add it to my list. So next time I need to use it, I just grab it.
Yeah.
That's what I like about this template. I really like the functionality.
And it also gives you the diagnosis.
So she's pregnant, but the poor thing also has pharyngitis. Okay. So, if he's going to order any meds, again, from here, this is just going to be all my orders down here. Counter date, medications. I think if we double-click here, yep, you get the medication module in a pop-up. All right, so you could just grab it here and then say order some penicillin. And I think I made her allergic. So let's see, Penny C, the penicillin B. So yeah, we'll just grab this one. Oh, that's interesting. Well, I'll just give her that anyway. 30, and I'm going to accept it to the chart. And there's my allergy reaction to penicillin. Okay, these have to be acknowledged. All right, so we can either pre-build in user preferences benefits outweigh risks, so the doctor doesn't have to type it every time and then acknowledge it. You don't actually have to type anything in there. That's up to the doctor, but you can create that in this little drop-down here so you don't have to type it in. All right, I'll show you how to do that. Leanne, did she show you how to do that?
Not from that one.
Okay. It's under your tools and preferences, and it's under the medications tab, and it's this DUR button right here, drug utilization review. So if I don't want to have to type every time benefits outweigh, and let me type it right this time, and I usually type RISK, and then I put in parentheses that way, and then we add it in.
Mm-hmm.
This is now added for Dr. Dorfman because it's provider driven.
Okay.
All right, so now if I go back to the medication module, and I'll order another, like I'll do an amoxicillin. Goodness, it's raining. I have a wall of water coming down out there. Amoxicillin. My poor husband hasn't left yet because he's driving and he didn't want to get caught up in all this rain. So we'll do this one. All right, and we're going to give her, actually I'm going to say she's going to take these for 7 days. So I'm going to stop her on the 8th. So it's automatically going to calculate for me. And then I'm going to accept it to the chart. And there is my,
And it gives you
again,
the flag.
pop-up. So now when I go to the drop-down, there it is now.
Oh, okay.
So I can just grab it. Acknowledge. Must be acknowledged and click done. That's what activates it to the chart. Okay, so medications can be done there. Highlight a medication. Oh, cool! I didn't realize they had that still on there. You can print educational materials. Let me see what it gives us. Oh, okay. I don't think you need to do that. You don't give out samples, do you? Do you give up samples, Leva?
Yes, we do.
Oh, okay. If they don't have education with them, you can print it out there.
Oh.
But I know Leanne showed you how to get to the education in the module, right?
Mm-hmm.
Okay. All right, so again, review systems. You can do the exam. You add your assessment. You can do a plan. Like, again, we did the throat culture already, so here's just a little, comment field for your plan if you want to use it. And again, you can fire right out to the custom plan, and you'll see what you get, which you've seen now quite a few times. All right, so you can use this one for the stress. Now, as far as I know, to bill for this, because this was a focus, problem that you took care of during the prenatal visit, I think if you come over to E&M coding over here, all right, it's going to be looking at OB prenatal. So if I say this was a straightforward in addition to the prenatal, let me see what this calculates out as. It should only give me, okay, there are less than 4 prenatal immuno. Okay, so we would basically have to do a manual code on this. We would have to say, let's bill a level, like 1 for it, and then submit the code. Because it's a prenatal visit, it's obviously not going to let you,
Bill a high code.
Yeah, but you can bill an additional E&M code because you address
Just go through it for the additional problem.
Exactly. So, which happens all the time, I'm sure.
Mm-hmm.
So I don't know how we'll see how your billing department does it. Well, so
Okay,
again,
I'm sorry, really quick.
I was going to say, do you want to take a little break?
Mm-hmm.
Okay, let's take a 10-minute break, or
okay.
Okay, so we'll come
10
back.
minutes is fine.
Okay, talk to you in a minute.
Alrighty.
Bye.
Clark is right, yeah. I will send you the email. Okay? So this is the right one she's using. Email her. Save the date. 12/9/80. for calling FM Comprehensive Healthcare Group.